7 o'clock. Okay, it's 2 o'clock somewhere, but here it's 7 o'clock, and I've got some Q's and A's to get through. So if you can just give me a minute, and I will get on with it. If you have any Q's yourself, then please feel free to unburden yourself on me, and I will do my best to. I'll give it my best shot. That's all I can say. I can promise no more. So without further ado, I'm going to start with this question that we've got asked by a viewer. Can we treat hyperpigmentation on the face? No. I feel like a lot of questions I ask, I say no to. Is that fair, or maybe I just remember the no's? I mean, we do a lot of stuff. There is a lot of stuff we can actually do, but hyperpigmentation on the face is not one of them. That would probably be more of a dermatologist. So hyperpigmentation is dark patches, dark spots and patches. And that would be usually some kind of topical treatment, usually some kind of non-surgical treatment. So we do surgery. We cut stuff out. And stitch it up, putting it bluntly. So that's our forte. In terms of non-surgical treatments like creams and peels and stuff that lasers and dermabrasion and these sorts of things, that's not what we are about. And that would probably be a dermatologist, I would suggest. And the dermatologist I normally recommend is Michelle Thompson, because she works at the Priory, which is a hospital nearby to my clinic. And she used to work at the City Hospital, where I was the consultant. So but a dermatologist would be the trick I would suggest for a dark hyperpigmentation issue on the face. All right, here we go. Oh, here we go. Oh, God. What are they? Do we offer treatment for dark inner thighs? What is this? Goodness me, I should have gone through these. Oh, my God. You don't want to know what's coming up. Oof, crikey. Who puts these questions on, right? Okay. Okay. Anyway, I'm a professional, so I'm just going to, like a swan, look like that, and then panicking under there. So, do we offer treatment for dark inner thighs? Is dark inner thighs a thing? I mean, hyperpigmentation on the face, I'm okay with. Dark inner thighs? Is that a typo? What could dark be a typo for? Okay, well, let's just say it's not a typo. I've got to be honest, I've never had a patient come to me complaining of dark inner thighs, but maybe that is because I don't treat dark inner thighs. Maybe that is a thing that I just was unaware of. But no, we don't treat dark inner thighs. Maybe dermatologist again, same as hyperpigmentation on the face. Hyperpigmentation of the inner thighs. I'm clearly not the man for that. That would, I would say, not me anyway. Sorry, I can't help with the first two, but let's see. Third time lucky. Can I help with the third thing? Come on, everybody, think positive. Come on. What's the third thing? Do we offer any treatment for atrophic / ice pick chickenpox scarring? I mean, that's a bit better. We might be able to help with that. So that's not a definite no. That's a maybe. We might be able to help with atrophic / ice pick chickenpox scarring. So, but usually I would say the mainstay of that sort of scarring is again a non-surgical treatment. So this is like acne scarring or say chickenpox scarring. They're sort of deep pits in the face, and that's why they're called ice pick, because it looks like an ice pick. And particularly if they're kind of multiple, it would be more like a resurfacing treatment, which means so you've got a deep sort of hole, and a resurfacing treatment will kind of take the top layer of skin off, something like a chemical peel or dermabrasion or laser, or there's many ways to resurface the face. They're usually on the face, these things, and that would mean that that deep pit would have less depth, if that, so you're taking the top off, so it's taking the depth out. So that would be, and again, we don't really do that. So we don't really do facial resurfacing. Again, that would be, I mean, plastic surgeons do that sort of thing. So that's, that's not unreasonable that plastic surgeons do that, but we don't. We, as I say, we specialize in sort of surgical treatment of things. If it was one kind of troublesome chickenpox or ice pick deep pitted scar, then that would be potentially treated surgically. You could cut that out and stitch it up and still have a scar, but it wouldn't be a deep kind of hole. So one scar might be reasonable to treat surgically, but certainly if they're multiple, again, it would be a non-surgical treatment. And yeah, we're not big on non-surgical. It's just I've never really embraced it, and I know I should, and people have said for years you should do it, and all that, but I don't do really non-surgical treatments. So that means Botox, that means fillers, that means lasers, that means chemical peels. Non-surgical treatment has never been something that's appealed to me, even though I know it is something that is popular and is requested in the world. So my main focus has been surgical treatments, and that's kind of what the forte of the clinic is. Surgical treatments for things, scars or lumps or bumps or lesions and things. It keeps on saying invite people as a guest. Am I supposed to? Do you want me to? Oh, hold on, I've got some questions. Sorry. So yeah, ice pick maybe if it was one, but most of them will probably be dermatologists again. I've got stuff here. Oh God, here we go. Oh, people have been saying things. God. What after scar revision surgery? What cream should I use? Do you operate in Birmingham now? Oh God, right. Right. Okay. Right. So after scar revision surgery, what cream should I use? So personally, first of all, I would say it's up to the surgeon. Surgeons have different regimes, so talk to your surgeon, number one, but I will tell you sort of just general terms. In my practice, I normally wait about 6 weeks before doing stuff to scars. So normally you have a sort of dressing on, and the dressing comes off after a week, and then don't do anything for 6 weeks because he needs to knit together. Now at 6 weeks, then I do suggest that people do massage and moisturize with creams, but I don't particularly recommend any type of cream. We have one called QV, which we sell at the clinic, which is a moisturizer, which is good. We sell that at the clinic because it's good, but I don't think it's particularly better than another cream. And I think if you have a cream that you use, a moisturizer, then I would use that. And for me, it's more the pressure than the actual cream that you use. So Nivea E45 aloe vera, you name it, cocoa butter, vitamin E. There's all sorts of things that people use, and I think I don't think there's any evidence. Gels, really, that is a silicone, not a cream, and you can certainly use that for lumpy scars. But for normal scars, you don't normally need silicone, and silicone's a bit different. You just apply silicone, and that's for a lumpy scar. As I say, you don't massage it, because if you massage it, you just rub it off. So yeah, in terms of creams after scar revision or after any surgery, really, it's just a moisturizer just to help it to soften the scar. So just and pressure and moisturizing it is the key. So yeah, as I say, we use QV, but you can use anything you want, really. And have I operated at Birmingham? No, I don't. I don't operate at Birmingham. It's a sore point, E squared. It's a sore point. It's gone to pot E squared, I'll be honest with you. The hospital situation in, well, I don't think it's just in Birmingham. I think it's everywhere. I think it's really hard. Cosmetic surgery has really not been embraced by a lot of the private hospitals. They are doing a lot of NHS work. They do a lot of insured work. So the Priory, which is a hospital just near where I work, where my clinic is, which I used to work at all the time, have said no cosmetic surgery. There's a new one that's just opened up in Birmingham called the Harborne Hospital, and they've said no cosmetic surgery. So no, so I'm still going up to Liverpool because my friend Hassan has got a place up in Liverpool. So that's where I'm working in terms of GA, putting you to sleep type operations. So not Birmingham at the moment. So lovely when you get there, but it is a little bit of a faff, I'll be honest, to go up to Liverpool. But nice that I know the people to work at, so it does work in that respect. But the distance is a bit of a thing, and you would have thought in Birmingham you'd be able to find a hospital. You would have thought, but clearly not. Have I got something? Is anyone saying anything? I have this problem when I wear I should wear a darker shirt because I can't see, but it's okay. I don't think anyone's saying anything. Yeah, right. Good cues there. What on earth is this question? Do you offer a service that removes Fordyce spots off the lips? I was thinking electro-desiccation or something more permanent. Electro-desiccation. Right, okay. You know what? General rule, general principle, if you got a thing, whether it be a Fordyce spot or whether it be a whatever, send us a photo. Yeah? Send us a photo. Bottom line, if it's a thing, but most of our treatment is cutting it out. So electro-desiccation, I'm not sure what electro-desiccation is. And when we do electrocautery, which is a bipolar diathermy machine, which cauterizes any little blood vessels and cauterizes stuff. But that's used in conjunction with surgery usually. We don't use that as a sort of treatment on its own. So electro-desiccation, drying out, electro drying out. So yeah, I mean, we can certainly remove things permanently, but we, as I said earlier, we mainly do surgical treatments which are permanent, which is the good news, but they leave scars. The good news about scars on the lip is that scars are often quite red and the lips are quite red. So scars on the lip are usually pretty good. So that's in their favor. But yeah, by all means, send us a photo of your Fordyce spots. And if you've got lots of them, and if you're looking for some kind of non-surgical treatment, which may be what this electro-desiccation is, then we're probably not the place for you. But if you just got one, and you want a permanent solution, we might be able to help. But we will tell you, or I will tell you, or Amy will probably tell you, or I'll tell Amy to tell you. Anyway, you'll get to know whether we'll be the right people for you or not, because as you can probably tell from the way this Q&A is going, quite a lot of things we're not the right people for. Hyperpigmentation of the face, dark in the thighs, acne, stroke, ice pick scarring, and possibly Fordyce spots on the lip. So anyway, there are lots of things we are set up to do. But if you send us a photo of something that we're not the right people for, I will let you know. We will just say, look, we're not the right people. We're not in the business of trying to encourage people to have things done that they may not be the right thing. So it might not be the right thing for you. It might be though, if it's like one thing. But as I say, if they're multiple and they're subtle, it may not be the right thing to have surgery on them. There might be some kind of non-surgical treatment, which again goes back to the dermatology axis that you might be And we've got one to finish on. So please, if you've got any questions of things that I can help with, then please do ask, because my last question here goes a little bit something like this. Can we remove an ovarian cyst? So again, I think I've been guilty of saying in the past that we can remove cysts from anywhere. And then we get all sorts of things like Bartholin cyst, ovarian cyst, Meibomian cyst. So, and I'm like, yeah, okay, well, no, we can't do those ones. So yeah, ovarian cyst is a no. Unfortunately, we don't do ovarian cyst. So ovarian cyst would be inside your abdomen. As a general rule, actually, this rule isn't strictly, but anyway, I'll say it anyway. If you can kind of see it or at least feel it, cutaneous, if it's underneath the skin, Often cysts you can't see that much, and lipomas you can't see that much, but you can certainly feel them. Then we can get to removing them. But if, well, maybe not obviously, but an ovarian cyst is inside your abdomen. You can't feel it, you can't see it. It's inside your abdomen. So you would need a laparotomy. You would need to sort of explore inside your abdomen, or maybe not a laparotomy, maybe a laparoscopy, but you need to sort of look inside your abdomen somehow. So that would be a gynecologist who would be dealing with an ovarian cyst. So yes, whilst it is on paper a cyst, it is a deep in your body, so anywhere on your liver, on your spleen, on your stomach, colon, any cysts inside your abdomen, lung, any cysts inside that you can't see or feel would not be something we would deal with. So ovarian cysts would fall into that category. But honestly, there's loads of things we do. Honestly, don't be swayed by what I've just said. Okay, there are loads of things we do. You got a mole, we'll do it. Right? You got a skin cyst, a lump, no problem. A lipoma, yeah, no problem. We do all this stuff. There's loads of stuff we do. Tattoos, we cut out tattoos. Not many places do that. We cut out tattoos. Send us a photo. We'll let you know. Loads of things we do. So please don't pay any attention to the last half an hour where I've been talking about all the things that we don't do. There's lots of things we do. Okay, send us a photo of your thing, whether it be a lump or a mole or a tattoo or whatever it is. Inverted nipple. Did I say inverted nipple? We do inverted nipples all day long. It's absolute, areola reduction. Yes. Right? Split earlobe. Yes. Repair earring holes, all sorts. Yes, there's lots of things we do. Where are you based? We're based in Edgbaston, Wendy Woo. We are based in Edgbaston. Edgbaston in Birmingham. So I don't know if you know Edgbaston. It's like near the Five Ways roundabout. So that's where we are. Frederick Road. So yeah. Anyway, I just want you to take away that there's actually a lot of things we do. There's obviously things we don't do, but you can't do everything, You can't do everything. So if you've got a thing that we do, then please get in touch and we will do it, possibly. So, yes, I used to live in Birmingham. There you go, Wendy Woo. Yeah, so you know the Five Ways roundabout? Just near there. I don't know if you know our eye opticians. I think it's called Ladywood Middleway or something, Ladybank Middleway or something. There's Frederick Road just off there. Anyway, just off Edgbaston, near sort of Council Road. Frederick Road is called. So Five Ways roundabout, Five Ways train station just around the corner. So yeah, good. Okay. So any other questions about locations or things that we do, or have you seen enough? So yeah, I think that's been quite. What's happening here? Haven't lived over 30 years, but I know it roughly. Okay. Yeah. Well, yeah. Well, it's quite central. Wendy Woo, quite central. You can walk from New Street, probably about 20 minutes, maybe half an hour walk from New Street. Five Ways is just one stop down. Do you have a price list? Yeah, we've got a price list, Wendy Woo. I was going to say what you're interested in, but if you tell me what you're interested in, I probably won't know the price because I'm not very good on the prices because I've got enough to worry about without worrying about prices. But if you want to know a price of something, Wendy Woo, two options. Number one option, message on here on TikTok. Can you message on TikTok? Is that a thing? If it is, message on TikTok and we'll message back. Or go to the website, staianoplasticsurgery.co.uk, and whatever you're interested in, mole, cyst, tattoo, whatever, or whatever it might be, there's a thing that says request a price, and put request a price, put your email in, and you get an email with a price of whatever it is that you're interested in. But yeah, all messages. Don't ask me because I don't know. So okay. Hopefully it's a thing that we do, you're interested in. You might not want to say here, but oh, mole removal, there you go. Okay, well, I do know the price of mole removal, actually. Well, you've got to send us a photo. Send us a photo on WhatsApp is the best. But moles are usually, unless it's a big one. So if it's a big one in a difficult place, it might be different. But it starts at either 798 or 898. I think it's 798. I think it's 800 quid. 798 or 89. Anyway, whatever. Yeah, send us the thing. But I think it's 798. And yeah, we send them all for histology. We used to do a thing where we said, oh, histology. So moles, you should really send us histology. I mean, I suppose skin tags and stuff, not so much about mole. But anyway, we used to have a thing where we had two prices. We don't anymore. We just send them all for histology. Yeah, all the aftercare. It's just a fixed price. Just includes everything, all the aftercare and everything. So, yeah, that's the price of mole removal. Right then. So, anyway, I hope you're all enjoying the sunshine. Shakira's joined. Nice to see you, Shakira. Thanks for joining. And I'm out. Yeah, Shakira's joined again. Is she? No, God, it's terrible glasses. Oh, dear. Right. Okay. Anyway. Right. I'm going to exit stage left, and I suggest you do likewise.